these past couple of weeks. This is the time of year that fad diets tend to surface. And one Scarborough resident turned to an age-old eating plan that he says changed his entire life. Dana Levinson has his story.
Desmond Cupid is cooking up a storm like he does every Monday.
It's only 1 day a week, right, for the 24 fasting. That's all. And then the rest of the week, I do what I have to do.
On Mondays, Desmond not only cooks his meals for the entire week, but he doesn't take a bite. He spends every Monday fasting. Having lived with type 2 diabetes, he was overweight and was on insulin for 30 years, but not anymore. At 85 years old, he has lost over 30 pounds and has kept it off for more than 5 years. He credits intermittent fasting.
Every Monday, which is today really, I'll have a cup of tea, right? And then during the day, I'll have some, what do you call it, just chicken broth.
Just chicken broth.
That's it. This is a boots way some weight.
After a few months of fasting 1 full day per week and following a restrictive diet, Desmond was off his insulin.
You're only on the one medication.
Yes, so I am. So therefore.
Desmond checks in regularly at the Toronto Metabolic Clinic with Dr. Jason Fung, a nephrologist who also specializes in weight loss and obesity medicine.
So you fast for 16 hours and you eat during 8 hours of the day. That's also called time-restricted eating. Other people will go to almost 24 hours. So if you go from, say, lunch to lunch or dinner to dinner.
Fung says the more popular type of fasting is finishing dinner early in the evening before 8 and then not eating breakfast until much later the next day, closer to noon.
There's two questions in weight loss: what you eat and when you eat. We constantly focus on the what to eat, and we never focus on the when to eat.
And while Dr. Fung says many of his patients report having more energy while fasting, he says this diet is not for everyone, especially for children and women who are pregnant or breastfeeding. And he also suggests anyone who is thinking about fasting should see a doctor first. He says that your body is in a fat-burning mode when fasting. But is fasting unsafe?
Other than being hungry, the question is, are you doing something very bad? And if you follow the physiology of what happens during fasting, the answer is no.
As for Desmond, he hits the gym at least twice a week. He says he will continue to fast every Monday and is happy to follow this eating plan for the rest of his life. Dana Levinson, CTV News.
Ariana.